Hi friends, today in this topic of ECG basic, I will talk about first degree heart block. First is the disclaimer. Caring Talks YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. By definition, when the PR interval in an ECG is more than 200 milliseconds, that is more than 5 small square, we call it as a first degree heart block. There is a delay without interruption in conduction from atria to ventricle. The delay occurs at the AV node. Marked first degree heart block is called when the PR interval is more than 300 milliseconds. The causes of the first degree heart block are increased vagal tone as seen in athletes or athletic training, inferior MI, mitral valve surgery, patients with myocarditis, for example in Lyme disease, when there is hyperkalaemia, or when we give AV nodal blocking drugs like beta blockers, calcium channel blockers, digoxin, amiodarone, and in some patients, this first degree heart block can be a normal variant. Coming to its clinical significance, an isolated finding in the ECG of first degree heart block is a benign entity. It does not cause any haemodynamic instability. So, no specific treatment is required for in case of first degree heart block. Here we can see that this ECG is showing prolonged PR interval. The PR interval is more than 300 milliseconds, and if we see the arrow, the P waves are buried in the preceding T waves. So this is the example of first degree heart block. If we see this ECG, it is also showing first degree heart block. The PR interval is very long, that is more than 300 milliseconds. So whenever there is increased PR interval more than 5 small squares, PR interval is from the beginning of the P wave to the start of QRS complexes. If that is more than 5 small square or 200 milliseconds, we call it as a first degree heart block. This is another example of first degree heart block. The PR interval here is about 260 milliseconds. If I zoom it out, you will see that from beginning of the P wave to the end of the start of the QRS complexes, the number of small squares are more than 5. So this is another example of first degree heart block. William Osler has said, to study the phenomena of disease without book is to sell an uncharted to study the phenomena of disease without a book is to sail an uncharted sea, while to study books without patient is not to go to sea at all. Thank you. With this, I conclude my today's topic. Keep learning.